Live Nation, these big corporations, they're going to do what they're going to do. In Europe, they're just as profit-seeking as they are here. But in Europe, they are more able to have open and honest conversations about drug use and what to do to prevent these fatalities, and they adopt a public health approach to do that. Whereas we aren't evolved yet because of the drug war in this country, and so it's easier to hide behind, for these corporations and the police, to hide behind this notion of just like individual responsibility. That, oh, if someone dies, it's their own fault. Blame the victim, they took too much or whatever, and there's nothing that we really need to do about it. When if we took a public health approach, we could actually, prevent these deaths. So I want to introduce Joseph Fred, who runs Mutual Aid Response Services. Good segue. Joseph is a colleague of mine and has worked festivals and tried to adopt a harm reduction approach along with the medical stuff that he does, and has some good insights into what's happening. So can we keep it to 5 minutes and then do Q&A?
Yeah, absolutely.
Okay.
So a lot of what I would normally talk about, you've already covered. So what I did is I talked with you in advance about a few key points, and then also, as you were talking, picked out a few other things to talk about. A little bit more about myself, and actually, funny thing I realized when you were talking about 1998, we met back in around 98, maybe 99, working raves together in different capacities. So didn't realize that was the start of it all. I was the chief of public safety for Burning Man for 18 years. So that's one of the major festivals I've been involved with. I've been working in the festival industry with risk and emergency management and public safety for over 20 years. Worked internationally, some of the world's largest festivals, worked with the largest EDM producers in the world, as well as small local events and underground events back in the day. I've also sat on the government side in terms of the regulation. I held the public health seat on the Entertainment Commission in San Francisco, so I'm used to seeing it from both the harm reduction side, both from how government might see it, as well as how we look at it from the production side of things. And I'm also part of a harm reduction coalition. My company is, with DanceSafe and a few other organizations that are involved with working together to sort of provide a better alternative and model to what currently exists. So a few points, and then we'll jump into the meat of Q&A, and I know some stuff will come up that'll affect all of us and be more interesting to have a dynamic conversation there. But show of hands, how many people here are aware of safe harbor laws? So only a few people. So one of the most compelling things that I see of young adults, everything from teenagers up to people in their early 20s, they are totally afraid when they are interacting with the medical staff at festivals, or even when you pick them up in an ambulance from a 911 call, that they're going to get arrested or get in trouble somehow legally for either being high and needing medical attention, or that because they brought their friend in, they were going to somehow get in trouble. If you think about it, if you came into the ER high on any drug and you got arrested afterwards, how many people would go to the ER afterwards? Right? It wouldn't happen. So safe harbor laws exist but are not really well known, and especially to young people who are most concerned not only about the police, but that somehow maybe mom and dad might find out about it, right? That might actually be more scary if you're a teenager. But either way, at least on the law enforcement side, you're not going to get a record. There are certain circumstances, of course, where law enforcement gets involved, where that's a different story. But we're just talking strictly medical, especially in nightlife, nightclubs, festivals. Your visit there is protected by HIPAA, the federal privacy laws that protect your rights as a patient, regardless if it's at a festival clinic versus going to an ER. And one of the biggest concerns when I talk to young people about their fear of getting help is because they're afraid that they're going to get in trouble. And that's what leads to, in a lot of cases, where people wait until they've already gone so far as to start having seizures or other life-threatening, near irreversible medical conditions, where if they just came in earlier and said, hey, I don't think my friend's doing so hot, can you maybe come check them out? And we can establish a rapport and a relationship so that if they get worse, and a lot of times they don't, they know where to go, they know it's a safe place, and we can have an intervention medically before the absolute worst happens. And hyperthermia and seizures are connected. A lot of times they happen side by side in terms of the way that MDMA develops in recreational use. Does anybody here know the number of minutes in hyperthermia it takes before serious long-term brain damage takes place?
3.
What's that?
3.
6 minutes. So when your core body temperature has reached 106 degrees or higher, which is the definition of hyperthermia, every minute after 6 minutes, brain cells are actively dying, and long-term negative impacts are happening. So if you wait until they're in full-blown hyperthermia, they're going to have a lifelong negative impact of that. Whereas if you get them before that happens, when you can get IV fluids and a lot of other therapy that can be done in the field before you even get to a hospital, provided that they have advanced life support on site, which most festivals now do as a matter of course, they can get, they can go home with their friends at the end of the night. They don't even necessarily need to go to the ER. They can be treated there, released, go home at the end of the night. And that's the best possible outcome. So if you're worried about your friends, what I tell people is if you're worried about your friends, take action, because that's when you can make a big difference. And if you're taking the same stuff that they're taking, if you both dropped at the same time, and they're feeling a lot worse, and let's say you're a small group of people, that's a red flag. Look around you with the group of people. If everybody else is sort of doing the same way, and one person is doing worse, that is a good sign to maybe go get that person help. They may not even realize they need it yet. So for example, if you're at a party and everybody's dancing and everybody's a little bit hot, but one person is just dripping with sweat. Maybe it's because they sweat a lot, but it could be that, and most often it's because they're diaphoretic, because they're starting those early signs of heat exposure, and that's where intervention is possible. So yeah, it's a slight detour from the rest of the night, but it's a lot better than the worst possible outcome that can happen to you and your friends with heat exhaustion leading to hypothermia leading to possibly death. And I think it's also really important, something that you mentioned, you were talking about sort of the differences between overdoses. A lot of what we see in festivals aren't overdoses. We see intense reactions. That's what we call when people are coming in under the influence, having some kind of emotional or physiological impact, but they're not in a life-threatening state. They're not truly in overdose. So we try to educate people. It's like, yeah, this person's having an intense reaction, because the word overdose is so loaded. So anything we can do to sort of bring that dialogue down will help be more rational and also make it more reasonable to have across the boundaries with people that may not be as understanding or agreeing with harm reduction as a concept. So I think I'm going to leave it at that, and then we can switch over to Q&A.